Welcome to our channel. Today, we are going to discuss a vital health topic that affects millions of people around the world: arrhythmia. Arrhythmia is a term that describes an irregular heartbeat. It can mean that your heart beats too fast, too slow, or in an irregular pattern. Understanding arrhythmias is crucial because they can lead to serious complications, including stroke and heart failure. There are various types of arrhythmias, and they can be classified based on their origin and how they affect the heart's function. The two main types are atrial arrhythmias and ventricular arrhythmias. Atrial arrhythmias originate in the upper chambers of the heart, called the atria. A common example of an atrial arrhythmia is atrial fibrillation, where the atria experience rapid and chaotic electrical signals. This can result in an irregular and often rapid heartbeat, increasing the risk of clot formation and stroke. On the other hand, ventricular arrhythmias originate in the lower chambers, known as the ventricles. One serious type of ventricular arrhythmia is ventricular fibrillation. In this condition, the ventricles quiver instead of pumping blood effectively, leading to a drastic drop in blood flow and can result in sudden cardiac arrest if not treated immediately. In addition to atrial fibrillation and ventricular fibrillation, there are other types of arrhythmias, such as bradycardia and tachycardia. Bradycardia refers to a slower than normal heartbeat, often below 60 beats per minute. This can occur due to various factors, including heart disease, aging, or issues with the heart's natural pacemaker, known as the sinus node. On the opposite end, tachycardia is when the heart beats too fast, typically over 100 beats per minute during rest. Tachycardia can also have different origins, like sinus tachycardia, which is generally a response to stress, fever, or exercise, versus more concerning types like paroxysmal supraventricular tachycardia or ventricular tachycardia. Symptoms of arrhythmias can vary widely. Some individuals may experience no symptoms at all, while others may notice palpitations, a feeling of fluttering or pounding in the chest, shortness of breath, dizziness, or even fainting. In more severe cases, especially with ventricular arrhythmias, symptoms can escalate to chest pain or sudden cardiac arrest. If you're concerned about arrhythmia, seeking medical attention is vital. A healthcare provider will usually conduct a physical exam and take your medical history. They may use various tests such as an electrocardiogram, or ECG, which records the electrical activity of the heart, or a Holter monitor, which is a portable ECG device that you wear for a day or more to capture your heart's rhythm in real time. The treatment for arrhythmias depends on the type and severity. For mild cases, lifestyle changes such as reducing caffeine and alcohol intake, managing stress, and avoiding certain medications may be sufficient. Medications such as beta blockers or antiarrhythmic drugs can also be prescribed to help manage heart rate or restore a normal rhythm. In more severe instances, procedures such as catheter ablation may be performed. During this procedure, a catheter is used to destroy the small areas of heart tissue that may be causing the arrhythmia. For high-risk patients, doctors might recommend the implantation of a pacemaker. A pacemaker is a small device placed under the skin that helps regulate the heartbeat, or an implantable cardioverter defibrillator, which can deliver shocks to restore a normal heart rhythm if a life-threatening arrhythmia occurs. It's essential to be aware of the risk factors associated with arrhythmias. Some of these include heart disease, high blood pressure, diabetes, obesity, smoking, excessive alcohol consumption, and a family history of heart problems. Identifying and managing these risk factors can significantly reduce your chance of developing an arrhythmia. In conclusion, understanding arrhythmia is essential for both prevention and management of heart health. If you recognize any symptoms or have concerns about your heart rhythm, do not hesitate to reach out to a healthcare professional. Remember to maintain a healthy lifestyle by eating a balanced diet, staying active, and managing stress effectively. Thank you for joining us today to learn more about arrhythmias. Stay tuned for more health-related content, and don't forget to like, share, and subscribe to our channel for more educational videos. Take care and keep your heart healthy.